Vanakkam, I'm Dr. Ramesh, Urologist at Kauvery Hospital, Chennai. So for Women's Day, I will be talking to you about urinary tract infections in women. So what exactly are urinary tract infections? These are infections in the urinary tract where the patient will be presenting with symptoms such as burning while passing urine, increased number of times that they want to pass urine, that is of increased frequency, and urgency to pass urine. Occasionally, it may be associated with fever. Patients may or may not have a little bit of blood in their urine or a discoloration of their urine. Patients may show a positive urine culture, that is, urine is showing bacteria or an infection with or without these symptoms. These are called an asymptomatic bacteriuria when a patient is not having symptoms but is having bacteria present. When there is presence of symptoms along with a positive urine culture, this is called a definite symptomatic bacteriuria or a urinary tract infection. Now the next thing is, other than the symptoms, how do we diagnose? Diagnosis we do certain blood tests, certain urine tests, we do certain radiological tests. So this can include ultrasound scans, CT scans, occasionally urine flow tests kuda nama pannalam. Then next is, how exactly do patients get urinary tract infections? So in the urinary tract infections, firstly in women especially, slightly poorer hygiene in the perineal region. Adukapma constipation. Because the urinary tract, motion passage, vaginal passage are in proximity compared to women. The tendency for increased infection, if there is a increased bacterial load on one end, can happen. So suppose patient constipation irundhaduna, and the area bacterial load adhigama irundhadala, urine passage they'll have an increased bacterial load and get an infection. Then patients having uncontrolled blood sugar levels. So sugar control illadnala, again infections can happen. Previously poorly treated urinary infection. So if patient has not taken the antibiotics properly or was misdiagnosed, or has not completed the course of antibiotics, or has gone and taken antibiotics from over the counter, just ask the pharmacist and they've prescribed a medication which need not be appropriate to their infection. After that, certain anatomical problems. So patient they are born with those anatomical defects, they can have these urinary infections also, resulting because of the defects. Most importantly, of course, is our hygiene levels. So normally in women, the vagina is self-cleansing. There are unfortunately advertised vaginal cleanses which are there, and people do tend to use these. So this should be avoided, because since as a natural cleansing mechanism, and the area or pH is naturally maintained by certain good bacteria. Suppose நம்ம இந்த cleansing solutions use பண்ணோம்னா the pH alter ஆயிடும். So அதனால proliferation of unwanted bacteria which can cause an unhealthy vagina. அதனாலயும் we'll have a dryness in that area. Certain women, especially postmenopausal, when there is a drop in the estrogen levels, and the areas again they'll have dryness, urethral area and the vaginal area. Lastly, but most importantly, especially in women, we have a tendency not to pass urine or hold back passing urine because the situation may not be appropriate. Public restrooms we feel might not be clean, we will not be going. Though this is not always within our control, excessive holding time of urine is also not good. When we have the sensation or urge to pass urine, we should go and pass urine. So in the diagnosis and afterwards knowing what all the symptoms are, we next have to come to the treatment. Treatment wise, as simple as just basic hygiene values, basic constipation or bowel and bladder habits nama change pandradhulinde to a little more next step where we go to prescribing antibiotics and certain other medication for the patients. Occasionally, patients, if they are having extremely severe infection where they come in very sick with fever, shockler pang, where they have very low BP, they need ICU care. And the madri patients, they will require intravenous antibiotics. They might require what we call stent placement. So the stent is a coil tube, kidney la bladder varaikum nam place pandrathu. Basically and the pus ella drain pandradhukku, infection la drain pandradhukku. Okay, and then finally, how to prevent it? We need to do most basic things. The hygiene maintenance, make sure our bowel and bladder is fine, make sure that our wiping, so when we wipe, we have to do a front to back wiping motion of the vaginal, urethral and the motion areas. We should never come from a back to front area after passing urine or motion, right? Then otherwise, what other things can we do to prevent it? Adequate taking of water. Intake should be at least about 2 liters per day totally. There are patients who may require more amount of water, especially if they've had previous history of stone formation. Those who are having recurrent urinary infections, avungalukku we'll be giving them some antibiotics which may be slightly more long term course. Another factor where they can have a cause for urinary infection, post coital or post intercourse, where a few patients can have urinary infection. Avungalukku we can give them a post coital pill which is an antibiotic to prevent urinary infections. So be safe, take care of your health, and make sure you manage with all these basic prevention methods. So thank you.